Okay, welcome everyone. My name is Benjani and I'm actually a clinician, and today we're going to be talking about GCS or Glasgow Coma Scale. So Glasgow Coma Scale is actually one of the very useful tools, especially in surgery traumatology. So in traumatology mainly we're talking about major trauma. So like we know, in major trauma a person can be reported to have fallen from a height of more than 3 meters, or could be involved in a road traffic accident where the net speed was exceeding 30 kilometers per hour, or this person could be thrown from or trapped in a vehicle, or it could be a pedestrian or a cyclist who could be hit by a car, or it could be an injury from a high or a low velocity weapon. And when we try to do the physical findings, physical examination, we find that this patient or this person has got respiratory distress, the blood pressure would be less than 100 millimeters of mercury systolic. Then we could have Glasgow Coma Scale or GCS of less than 13, and we could be able to find that there is a penetrating injury or more than one area is injured. Now, amongst the physical findings that we've described, we've got the Glasgow Coma Scale. So what is the Glasgow Coma Scale? Others could think this is some sort of a machine or an electrical appliance or something like an oxygen machine or what, but this is actually not. This is simply a tool that is used to assess the level of consciousness. Now, this is something that should be in our head, and we should be able to use it within seconds, less than a minute. We should be able to come up with a GCS of a patient. This GCS or Glasgow Coma Scale is divided into three main domains. So each domain has got scores. So we have got eye opening. So eye opening has got 1 to 4 points. So in eye opening, if we try to call the patient, we shake them, we do what, they are not responding, they are not opening eyes at all. That is score 1. So no response is score 1. If they open their eyes in response to pain stimulus, that is score 2. If they open their eyes to voice, that is score 3. If they are opening their eyes spontaneously, that is score 4. Verbal response is the next domain. So if there's no response, they are not responding, we try to call them, we try to do what, there's no voice coming out, that is score 1. If the words that they are uttering are actually disoriented, if they are disoriented or they are simply making some sounds, that is score 2. If they are uttering some words, though those words could be inappropriate words, that is score 3. They are just words. Then if the words that they are coming out are confused words, if they are confused, that is score 4. Score 5 is when the words are oriented. The words are oriented. Coming to motor response. So for motor response, it is graded from 1 to 6 points. 1 to 6 points. So motor activity we're simply talking about is a patient able to move, or are there any muscles, are there any organs, are they able to lift their arms, are they able to do what, are they able to simply move. So score 1 is where a patient or a victim makes no movement at all. So no response is score 1. Score 2 is where there is a bit of some extension. So we can have abnormal posture, can be wrist, can be arms, can be the legs, or it can be toes or head or neck or anything, as long as there is some extension that is happening there, we'll score them as 2. If they are able to flex their arms, there is some flexion happening there, though the flexion could be an abnormal flexion. For example, the pain is on the umbilicus area, that is where the injury is. You try to stimulate pain from that area. They are flexing their hand but taking it to the head. That is abnormal flexion. So as long as there's some flexion, we'll score them as 3. Then if they're able to withdraw from painful stimulus, we'll score them as 4. If they're able to localize to pain stimulus, we'll score them as 5. But if they're able to obey commands, we'll score them as 6. You tell them lift your hand, they lift their hand. Open your mouth, they open their mouth. Do this, they able to do that. Then we'll score that as 6. Now, how do we grade the GCS? Okay, so once we correct the scores from eye, verbal and motor responses, we should be able to add to come up with the total. So if eye opening, for example, it is 4, verbal response is 4,